Hey everyone, thanks for joining us in our podcast series, Health of Our Nation. My name is Romero with HRBC Insurance, and in this edition, we have my father, Henry Romero, interviewing our close friend, Larry Baca with Inter Valley Health Plan. They go over managed care and how it got to where it is today, their perspective on social media and digital marketing, as well as how Inter Valley thrives as a not-for-profit health plan based here locally in Southern California, and how they do so with excellent customer service. Hope you enjoy.
Hello and welcome to HRBC Insurance's 2019 interview series, The Health of Our Nation. My name is Henry Romero with HRBC, and I have the pleasure of having Larry Baca with Inter Valley Health Plan with us today. Welcome, Larry.
Thank you, Henry. Glad to be here.
For the viewers that may not know who Inter Valley Health Plan is, can you let us know who Inter Valley Health Plan is, how it operates, and how you affect healthcare space, and what do you provide for the patients?
Great. Inter Valley is a local health plan. We've been in Medicare for over 40 years. We are celebrating our 40-year anniversary this year.
Congrats.
We are based in Pomona, and we are one of the only local non-for-profit healthcare companies in this region. Our specialty is customer service. We really believe that members have a lot going on in their healthcare, so any assistance we can provide to them helps their experience. So we have a full team of member care specialists at our corporate office. And when you talk to one of our people, you're always talking to an Inter Valley employee.
Tell us a little bit about being nonprofit and about your customer service experience, because I know you're at the top when it comes to customer service.
Sure, absolutely. As far as the not-for-profit, we're a not-for-profit, not to be confused with a non-profit like the Boys and Girls Club or clubs like that. And simply what that means is we do not have stock. There's no shares of stock that people buy. We are run by a local board of directors, not a group of shareholders that own Inter Valley Health Plan.
Sure.
And what that means that any profits that we make, any monies that we make in excess of our costs, go back directly into the health plan in terms of benefits and services. So that is the primary difference between us and, say, some of the other plans out there that are for-profits, and their profits go back to shareholders in terms of dividends and monies out of the health plan. Our money goes back into the health plan. And a good example of how we use that money is our customer service, as you mentioned. Our customer service team is top-notch. One of the things we do differently than most of our providers is we answer the phone.
Yes, you do.
And it sounds simple, but anytime a member calls us, they get a nice voice that says, Inter Valley Health Plan, how could I help you? And then we direct them to the appropriate department depending on what they need. If they have a pharmacy problem, right, there is no tree that people push. 1 for this, 2 if you're a provider, 3 if you live out of area. That's confusing, and people don't have to wait 4 or 5 minutes before they get a live person. They get a live person to start with. And what we hear from our members is that is a huge relief that helps them talk to somebody right away, get the help that they need, and then move along with their daily life.
Perfect. I know firsthand that when I call to talk to a pharmacist about a prescription need for a client, we get right through. There's no pushback.
Mm-hmm.
So I appreciate that. And I know the members do too. So thank you.
Absolutely. It is. Today's healthcare is complex.
Yes.
So there's various different touch points the member deals with. They deal with the doctor's office, the staff, maybe a specialist, and then ultimately the pharmacist. And there's tons of places where something could get out of whack, so to speak. And so for the members to have an easy way to reach out to us, get everything back in the order that they need it, helps them improve their health and then get on with their daily life.
Perfect. Let's talk about some misconceptions that might be out there in the healthcare space with the doctors, the brokers, maybe some patients of Inter Valley Health Plan. What are some of those misconceptions that you know about?
Well, I think there's just a couple. One, just a specific misconception is there seems to be a lot of people with the thought process that a small plan can't survive in today's market.
Okay.
And you see a lot of our competitors consolidating together, and
Yes.
you see a lot of the plans are owned and run by the large national healthcare places, people like United Healthcare,
Sure.
Aetna, Anthem Blue Cross, which are multi-state, across the nation, but all are for-profit plans, so they're all in the business to make money. And InterValley is a not-for-profit, as we've mentioned before. And our goal isn't to be the largest plan. Our goal is to improve the outcome of our members' health status. So we're not focused on making money. We're focused on serving the members that we serve, making sure they have access to good quality health care, affordable prescriptions, and co-pays that they could afford. And so we believe that health care is best delivered at the local level,
Sure.
and we feel we're well positioned for that. It isn't our goal to be the largest, it's our goal to offer the best service to our members. And then the other misconception, I think there's still a lot of the general public out there that believe that the health plans make health decisions. That when someone goes to see their doctor and the doctor says, well, you need to go to physical therapy, or you need to have an operation on your heart or your knee or your foot.
Sure.
A lot of people still believe that there's a team at the health plan that reviews those and then we approve or deny them, and that's simply not the case. All the healthcare decisions are made by the doctor and the doctor's medical team.
So if I go to my doctor and they're under a medical group and they refer me, it's up to my medical group and physician to approve that.
That is correct.
Doesn't fall back on InterValley.
Doesn't fall back to InterValley.
You know, I think you're right. I think that's one of the biggest misconceptions because we always hear that. Switch my plan because my plan doesn't approve X, right? So we as consumers and brokers need to do a better job of educating that Medicare beneficiary
Absolutely.
on what their rights are. And
Absolutely.
who actually approves it.
And I agree. And I think the other culture shift is, medicine is different today than it was when we went to the doctor with our mom, for you, 40 years
Don't
ago.
age us.
Yeah. But,
Were
we
there
used to go
doctors
to
back
the
then?
doctor and trust everything the doctor told us.
That's right.
And, I don't think we need to be blind followers and just go and say whatever you say goes.
Sure.
But today's world, with the advent of the internet and the access to information, people go into the doctor's office and tell the doctor what they need and say, well, I saw this on TV and I did some research and I think I have XYZ condition or 1, 2, 3 condition, and here's what I need you to do about it. And oftentimes the easy out for the doctors, rather than saying you don't need that, the doctors will very quickly say, well, your insurance doesn't cover it.
Right.
And so the patient feels like, oh, it's the insurance company that's making those decisions, and that's simply not the case anymore.
Yeah. Good. Well, let's talk about Larry. So Larry, how long have you been in the healthcare space? Have you always been in the healthcare space? And what's your role now? And how did you get started?
I've been in the healthcare space longer than I'd like to admit,
Okay.
to be honest with you. I graduated from college, and to be 100% honest, I had no idea what I was going to do. I took a job at a bank because it was in downtown Los Angeles, and just the opportunity downtown LA, get dressed up for work, was just, for me, made me feel successful. It was different than the life I had imagined of working in a factory or at a car dealership, fixing cars, or
Sure.
at a restaurant, washing dishes, which is what I did through high school. And so I really enjoyed it. But as the corporate part of it started to change, our company was bought, we were laid off. And I went to talk to a very good friend of one of my uncles who was an HR manager. And he said to me, well, it looks like, you have some skills here, you have a background of, successfulness and did well in school. He said, I'm going to have you talk to one of my friends, and he'll give you some thoughts and ideas of what you should do next. And unbeknownst to me, his friend was the director of sales, and he hired me. So I went to a meeting that I thought was just kind of a help me out, help your friend's nephew figure out his career path. And in reality, it was an interview.
Nice.
And I wound up getting hired at InterValley Health Plan back in the days when nobody knew what an HMO was. And so I started there as a salesperson. I was there a couple of years. I moved on to a larger plan that was ultimately bought by Blue Shield of California.
Okay.
And I stayed at Blue Shield for 9 years. And there I developed some skill sets and felt that my role was in leading people, training, development, and so I became a manager, and ultimately I was promoted to director of sales. And then Medicare went through a tough time back in the day, and so there were a lot of layoffs. I was lucky enough to transition over to Pacific Care as director of sales for individual products,
Okay.
which I really enjoyed, built our team. And then we were ultimately bought by United Healthcare.
That's right.
And so I spent another 9 years at those two organizations, and I came back to Inter Valley about 10 years ago. And currently my role is I'm the director of sales and marketing. I'm the department head, so anything that has to do with our sales efforts, our marketing, our advertising, my team handles that. And it's been a great opportunity. The staff, the team that I work with is amazing. They're amazing people. We are local, which is different than most of the other health plans out there. So we live and meet the people that we serve on a daily basis. So there are times I'm at a grocery store or at a restaurant and I happen to have on an Inter Valley polo shirt or shirt, and people recognize it and tell us, that's my plan. I'm very happy with that, and that's a great feeling to know that what we do impacts people and people feel good about it.
Nice. And your shirt is nicely pressed, I can tell you that.
Thank you. Very nice dry cleaner.
Yes. So, as the Director of Sales and Marketing for Inter Valley Health Plan, what are some of your aspirations for Inter Valley Health Plan? Short-term, long-term, where do you want to see the company go?
Well, I think for us, or for me personally, my answer is the same, whether it's short-term or long-term.
Yes.
We want to be the local expert for Medicare health plans. So people live in our service area, which stretches from Pasadena out to Palm Springs, all the way up to Victorville, Hesperia, the high desert, down to Temecula, Murrieta, okay. But especially in the region that we started, in which we call the core, Pomona, Laverne, Chino Hills, the corridor between the 15 freeway and the 57. We want to be the expert. We want to be the most well-known plan, offering the best service, helping our members get access to care, maintaining healthy lives, and aging, because we are a Medicare-only plan. We don't have commercial products for working people. All we do is Medicare. We want to help people age with dignity, with good health, and to feel vibrant.
So if I can put you in a room full of brokers, doctors, medical group directors, patients, what kind of insight would you give them or share with them about Inter Valley Health Plan?
Our message to that audience is the same. We believe that our service levels are tough to beat. So when you place a client, when you take a member and make them a member of Inter Valley Health Plan, you can rest assured they are going to be taken care of. Our disenrollment rate is very low, which means our members stay. They don't leave us and join other plans.
They do stay.
Because they like the service that they receive. We do continue, and part of my role at the office is to make sure that we get those messages out to our members to say, if you need assistance, we're here to help you. Call us, email us. We do have to get up to speed on the new methods of communication. Today's people do more and more email, chat. They use the internet, text, and we have to be able to respond to those people in those methods. So we really want to be a plan that's known to give customers the information that they need in the way you want to receive it. So if you want us to talk to you, we'll talk to you. If you want us to email you, we'll email you. If you want to come to a meeting, we have meetings available. If you want to meet one-on-one, we have people that are available one-on-one. But we want people to know we're not here to make money, we're here to improve people's health.
Good. I think that's important, what you touched on, the future of communication, right? The
Absolutely.
Future of dealing with the patient, because it's not old school anymore. It's not about come in, we can sit and talk, digital, right? That's why we're doing this interview.
Absolutely.
Because it reaches the masses. So, and it's good, it's refreshing to know that Inter Valley Health Plan is embracing that instead of pushing back, because change, as you know, it's pretty difficult.
Absolutely.
Right? So let's talk about that. How is Inter Valley Health Plan dealing with that change or transition into the new era of social media, digital marketing, etc.?
Well, I think, you have to embrace it. We have to find people that are good at it. And I think if you go to our office, the average age, especially of my team, is much younger than it was even 5 years ago.
So you're the oldest.
Yeah, absolutely. We've had to bring in some younger folks that are experienced in social media, experienced in digital marketing. You'll find Intervalley's Twitter is a lot more robust than it ever has been, along with our Facebook page. We try to be more interactive, where we have posts that are designed for people to respond and share information. As an example, our Facebook pages, you'll find posts. Holiday time, we did a post around, tell us about your favorite family recipes and share those. We do things like that to encourage people to post and to engage with other folks, because our society is becoming more and more digitally focused, where people engage with each other, but not face to face like they used to. I mean, when was the last time someone used the phrase with you, hey, do you want to go have a cup of coffee? But they'll engage you on your Facebook page, or they'll text you, or they'll send you a tweet to say, hey, what about this or what about that? And so I think we have to embrace that. We have to understand that even the senior market is embracing social media, and that is a difficult idea for a lot of people to understand. And I can give you an example. I was at a senior center recently, and there was a gentleman there, very older, had to be high 70s. And he asked for information on Intervalley Health Plan. And so I said to him, hey, no worries. Give me your address and I'll put it in the mail to you. And he looked up at me and kind of smiled. And then he said in a very broken accent, because English was not his first language, he said, no internet?
No internet.
And I said, oh no, hang on. So I gave him our website address, and he was able to get what he needed on his own. And so I think that is where we have to turn. This is the information age, and we do have to allow people to obtain that information. And I think for marketers, for plans, for I'm sure you guys as an agency, the fear is giving people information without collecting their data. So how do you respond? If I give you plan information, I tell you about our doctors, but I don't know who you are, how do I follow up with you to kind of pull you back into us? And I think there's a lot of nervousness and anxiety about that. But if you do it right and you have good plans, good benefits, good reputations, they'll come. And one of the things I think that we're finding through the data that suggests that people want to do their own research, but at the end of the day, they're going to want to talk to somebody directly before they make a buying decision. And that's true not just in healthcare, but in any of the industries out there. People go online and research cars, but at the end of the day, they still go to the dealership to make the purchase.
That's
and,
right. Well, let's give you a plug. The same. Facebook. How do we find you on Facebook?
We're at Intervalley. Go to facebook.com/Intervalley. Our Twitter is twitter.com/Intervalley.
Okay, there you go. Now you know how to find them. So, a couple of really interesting points about digital marketing, social media, some really good input there. I can tell you, I have a brother that's Medicare age, and he's one of the ones that's hard to convince because we're in a group text, and we text amongst the groups, but then he calls each of us, what did you text? So, but I think, like you said, the majority of the seniors now are different than 5 years ago, right? Or 10 years ago. So, yeah. And I think Gary Vee puts it out there perfectly. Don't be afraid to give the information away for free. Because if you share that information before your competitor, you're going to have even more credibility.
Absolutely.
And people will come back to you for the answers. So, yeah, I think that's our philosophy right now is, hey, let's put it out there. Because I know competitors are going to watch, partners are going to watch, but we're not in fear of what we give out. We want people to get the information. And that's why we have you.
Absolutely. That's what we're here for.
Absolutely. So, Intervalley Health Plan. Tell us a little bit about what do you do right, and who else out there does well in the Medicare space? You don't have to name names, but
Sure.
are there other agencies or companies that do it right?
Well, I think locally, we're in one of the most competitive markets there is. Southern
Sure.
California is the mother lode for Medicare plans, and so
Yes.
every plan out there is here. There are a couple other not-for-profit plans like us that I think have focused on customer service. In fact, one of them I could think of, their name starts with an S.
Okay.
Their ads mimic ours.
Okay.
And so they talk a lot about customer service, member satisfaction, getting the help that you need. And I think they do a really good job of taking care of the members, similarly to what our philosophy is. I go to a couple conferences every year on Medicare Advantage, and there's a plan in New Orleans called People's Health
Okay.
that does a really good job of engaging its members, giving information on staying healthy, staying vibrant, staying alive, and doing things that make people feel like there's a reason to get up every single day.
Good.
And I think that is really what we have to focus on at Inter Valley. That's what we want to focus on. Giving healthcare benefits, saying, well, if you choose our plan, you can go to the doctor and it's not going to cost you anything. That's great. But unless we help you understand why you need to go to the doctor, what questions you need to ask your doctor, and then what you do following that doctor appointment, it's really of very little value to you. Additionally, some people, are working hard to stay healthy. People are living longer, but society is getting different. We talked a lot about digital marketing. Well, there's still a real large percentage of the people that we serve, the older folks, people beyond 65, that are used to engagement with a lot of people.
Sure.
Come from big families, yet some days they may not talk to anyone. And so in Inter Valley, we operate some retail sites where we bring our members in, and you don't even have to be a member. We do, non-members can come in as well.
Did you hear that?
And we
Non-members.
have classes, we have services that we offer people that can walk in, get a cup of coffee, sit in our lobby, read a newspaper, engage with other like-minded people, like-aged, and have a good time and feel like they're engaged in their community. We want to be a community health plan. Our goal is to service our communities so that the people who join our plans feel good about their health, feel good about being a member of Inter Valley, but not necessarily just so they could go to the hospital or go to the doctor, because we help improve their day-to-day life.
Good. You talked a little bit about managed healthcare, which kind of goes away from this, but I think it's really important to talk about. I have been in the managed healthcare space since 1985. So I've seen it evolve. I've seen it go from being a really bad name in the industry to a really good name in the
Mm-hmm.
industry. But I think there's a lot of people out there that still have a misconception of HMOs
Mm-hmm.
or managed healthcare in general. I know there are studies to support that if you're part of that system, you have better outcomes. Healthcare to help the consumer better understand why it's important to have your health managed, not only as an individual but as a community.
Sure.
So let's talk
And
about
I
managed
think,
healthcare.
managed healthcare means more than just having access or being approved or denied access to
Sure.
specialty care or other hospitals. And I think where the disconnect happens is, especially today where there's more and more information available, people everywhere know a story of one person who got sick
Yeah.
and had a bad experience, but they don't understand that medicine is a practice, and that's why we say doctors practice medicine. And you may have a condition and see 5 different doctors. You may get 5 different treatment options.
Right.
And so I think people have to understand they have to be actively engaged in the process. They have to ask questions. They have to talk to their doctor. They have to find out what is the best treatment plan for them. But at the same time, they also need to be engaged in a preventative way. And managed care really has done a lot the last 15 to 20 years helping people with preventative care.
Yeah.
And we do have to get people to understand that they have to manage their diet, their weight, that they get a little bit of exercise. They have to take care of themselves so that they also have to get their screenings and get in to be seen. to find little things before they become big things. And I would say the average person, the average American, puts more time and energy into maintaining their car than they put into maintaining their health.
I agree with
And I think we have to shift that model so people get the care that they need, they get the screenings. You can name 100 examples. Men need to get their colonoscopy to help out with prostate cancer and colon cancers. Women need to get mammography to make sure to, to find breast cancers and other types of things. And that's just not something people want to do. I think there is still room in managed care to help the folks that get complex cases.
Sure.
Because, as you get to the more complex cases, there are different specialties that can help. And so as a managed care, as an industry, we have to find ways to be able to provide people access for needed care. And there is a huge difference in needed care and wanted care.
Yeah.
So there's tons of people who go to the doctor or can get the care that they need at the local PCP office. They don't even need to see their primary doctor. They could see a nurse practitioner or a physician's assistant for a cold, for strep throat, for a minor illness. But those people are so convinced, no, I need to see a specialist for that. I have a headache, so I need to see a neurologist. And those are where there's a disconnect with what people need and how things should work. And those disconnects cost the industry millions and millions of dollars.
It does.
And if we could take out some of those, I don't want to say misspent or misused, but if we could direct those resources differently, then there would be better outcomes for people as they get the more complex cases. Because if you get a cancer, if you get something huge, yeah, certainly you want to see the best of the best to have you taken care of.
Sure.
And that may mean that the health plans need to find ways to get you to UCLA Medical Center, to get you to Scripps in San Diego, to get you to the centers of excellence for your particular need. But it can't be for something that can be accommodated at the local level.
That's right. I think we can do a segment on managed healthcare. Wow, there's so much to talk about.
Oh, absolutely.
Right? Because there's so many different components of managed healthcare that go into the star rating, for example. And for those of you that don't know the star rating system, CMS imposed a 5-star rated system where it mandates that not only the health plan, but the medical group IPA doctors perform at a certain level, right, to improve their performance, which in turn rewards with monetary compensation, or what do you call it?
Reimbursement.
Reimbursement by CMS. So I know InterValley strives to get that top star rating, but let's talk about some of the things that are out of your control in determining provider.
Well, to start with, the STAR measures are very complex. I mean, there's over 50 measures that CMS, which is the arm of Medicare, uses to determine the STAR ratings. A lot of that information is data-driven, so there is no, it's night and day, black and white data. The percentage of your members that received a flu shot, the percentage of your members that received their breast cancer if they're female, things like that we can work with our membership by messaging, letters, calls to say, Mrs. Jones, it's time to get your mammogram. Can we help you out with that? And we'll help make the appointment or whatever. So some of that is data-driven, that it's just, you get what you get. And we do very well in those areas. Some of the measures are subjective, and they're based on surveys that the members receive. So CMS will randomly submit surveys to your membership that has questions like, are you healthier this year than you were last year? Are you satisfied with the level of care you received? Very subjective questions. And of course, those are based on the member experience at the doctor's office, which is not a function of what we do specifically as a health plan, but it does affect our rating. Right. So we need to work more closely with our providers to let them know patients need to be seen timely, And we also need to get better messaging to our membership to let them know if you're waiting 4, 5, 6 days for a referral, give us a call.
Sure.
Pick up the phone, call InterValley. There's a chance that maybe that referral got lost. It's on somebody's desk. It just needs to be processed. Or they sent you something back to the doctor for more information. There's lots of things that happen that InterValley could help speed things up. Same thing when someone has a medical issue, they go to their doctor who refers them to the specialist. They call the specialist, and the specialist says, well, first available appointment is 4 weeks or 6 weeks. And the member says, yeah, but my knee hurts today.
That's right.
Right? So a lot of members will just make the appointment and wait. Or some will just say, just forget the whole thing and I'll just deal with it and load up on Tylenol or some other.
Ibuprofen.
Yeah. So we need the membership to know to contact InterValley so that we can call the doctor's office. We can call the we need to get them in sooner, they're in pain, or we need to look at the rest of our network and there may be a different specialist that's available that can see them sooner. So we'll do the legwork for the members. We just need to make sure the members know that that help's available. And we're doing a lot of things to make sure we do that today so members receive consistent outreach from us so that they know if you have a problem, call us. Problem is you get the letter today and maybe your issue is 6 months from today.
That's right.
And we need to depend on you to remember that. So we have to find better ways of connecting with the membership.
Got it. Let's jump into Larry Baca, the scratch golfer.
I wish.
So, I know you love to golf, but what else do you like to do? How do you control your health and wellness? What other hobbies do you have?
Well, my health and wellness, I play golf, I walk a little bit, I don't do a lot, and I do have to start practicing what I preach a lot better. But my wife is a very healthy eater, which means I'm a healthy eater.
Okay.
So, I don't get to eat the hamburger and fries unless she's not around.
Okay.
Which is tough because she's always around.
Right.
So, dinner and diet at home is a lot more healthy offerings than I used to have, so that's been good. I do see my doctor on a regular basis to make sure that I get the screenings. We're getting of the age where there's things you have to get checked, and
right.
Dr. Starr has been phenomenal, and I feel pretty good about that. As far as hobbies go, I do like to play golf. I do like to read. I read usually 2 books a month. And I try to rotate. I do read a lot of biographies because I like to hear how people have been successful, challenges that they've had, what they've done to overcome it, and just to read about people's experiences. I'm also a big, I was a history major in school, so I do read a lot of historical books, specifically back in the mid 1900s. I do enjoy reading about World War II and all of that era, and so I do a lot of reading there. I have 3 adult daughters that are amazing, and spend a lot of time with them, try to get to dinner or Sunday brunch. We're a big Sunday brunch family, and we hang out, and that's good to see. And I have 3 sisters, and to spend time with them, and my brother is also high on the list.
Very nice. Thank you. Thanks for sharing. All right, so now it's your turn to be the interviewer.
Sure.
So do you have any questions of myself and HRBC Insurance and what we do and what we bring to the table?
No, we appreciate our partnership. HRBC has been one of our longest contracted agencies, and you guys have always done well by us with production and also compliance. And I think compliance is a big key to the puzzle. What I'm concerned about from the health plan side always, and not just with HRBC, but with all of the agencies that we contract with, Medicare today seems to be the, I hate to use the phrase cash cow, but Medicare seems to be the place where agents understand there's still opportunity for them to make a living.
Sure.
We all know what's happened to the individual market. Brokers that focus on individual, there's just not a lot of dollars there. The small group market is really rough to compete in today, and the plans that do small group, they've done a lot of work around doing business themselves, so they don't really use brokers like the way they have in the past. So you see more and more brokers getting into Medicare, including financial planners and other people that just haven't done Medicare before in the past. Our worry is being such a highly regulated industry, how do we keep those new people in compliance? How do we make sure they understand the compliance complexity that we have? And Medicare CMS does a very good job of protecting the Medicare beneficiaries. But I just worry about brokers needing to make money fast, and what are they doing to make sure, and what are we doing as an industry to make sure that they understand the compliance component?
I appreciate that. And I can tell you at HRBC Insurance, that's high on our list. So we have compliance training, we have a compliance manager within HRBC Insurance. We don't let flyers or marketing pieces go out without it being reviewed for compliance, because I agree with you. It's such a volatile industry, and it is highly regulated, that one misstep by not only the agency but the agent could cost the health plan heavily. So I know you rely on our side as a partnership, but you don't want us to affect you negatively either. So I'm glad you brought up compliance, because if you're an agent and you need help with compliance, that's what we're here for. We're here as an FMO to help you adhere to the policies and to be compliant in everything you do within the Medicare space, because you're right. If you do it right, it could be a good career, right? It could be a long-term career, as it should be, but it's doing the right thing for the right reasons. And one thing that is at the top of our list or culture is doing the right thing for the member. You always do the right thing for the member. And if you do so, you will always be in compliance. So I want to take this opportunity to thank Larry Baca, to thank InterValley Health Plan for joining us today. We will have Larry's contact information somewhere on this segment in case you want to get a hold of him. We will have InterValley's information in case you want to get a hold of InterValley or enroll. Actually, if you want to enroll as a member, contact HRBC Insurance and we can put you with InterValley. No need to go direct. But thank you, Larry.
Thank you.
Thanks for your
Appreciate the time.
All righty. So, Health of Our Nation 2019, HRBC Insurance, Henry Romero, we're out. Thanks for joining us.